Thank you very much, Lukoi. A very good morning to all of you, His Excellency, President William Ruto, our Cabinet Secretary for Health, Honorable Aiden Duale, World Health Summit President Axel Prius, and International President, our own Dean Lukoi Atvoli, distinguished ministers, excellencies, guests, participants, a very good morning to all of you. Ham Jambo. It is such a privilege, a deep privilege for the Arkhan University to hold this World Health Summit regional meeting. It is an honor, a true honor, to be among so many leaders in African healthcare and beyond, and to share reflections at such a pivotal moment. For global health, 2025 marked the end of one era and the beginning of another. We are confronting a new reality defined by funding constraints, the rise of technology and artificial intelligence, and a decisive shift towards local ownership, amongst other profound changes. In such a moment, ladies and gentlemen, the critical question is, what will success require? I see three essentials. First, confidence. Strong confidence in Africa's capacity to transform health for its 1.5 billion people. Despite recent challenges, the continent's progress is real. Life expectancy has risen by an average of 10 years per person. Maternal and child mortality are in steady decline. HIV, tuberculosis, and malaria have all reduced. But challenges do remain, some quite serious. Climate change, chronic diseases, the digital divide, inequity, and others that we will have to overcome. But I see a sector that is more capable than ever, better positioned to integrate systems, harness technology, and train the workforce needed for quality care and ethical leadership. Secondly, partnerships. At a time when global cooperation is faltering, progress, ladies and gentlemen, depends on creating meaningful partnerships, creating a force multiplier where our collective impact is far greater than the sum of our parts. At the Arkhan University, partnerships are central to our work, from governments across East Africa to institutions such as the WHO, UNFPA, NIH, KFW, the Gates Foundation, Hilton Foundation, Wellcome Trust, and others. We hope that this meeting provides the meaningful platform for developing and strengthening partnerships, North-South partnerships, and more importantly, South-South partnerships. Thirdly, strong local institutions, those that build capacity through education, research, and care. There is much to do. As an example, Africans spend nearly $7 billion annually on medical care outside the continent. These are areas, these are things that we can and we should reverse. For nearly 70 years, the Arkhan Development Network, or AKDN as we call it, has contributed to health in East Africa. Today, we operate 5 internationally certified hospitals and over 100 healthcare facilities serving nearly 2 million patients annually. We train more than 1,200 health professionals across multiple programs. We believe that research, which is important, research should be contextually relevant, and in 2025 alone, we secured over $30 million in new research funding, advancing work in critical areas such as aging and predictive health. The goal is to ensure Africa as a knowledge generator, not just a consumer. Over the next 3 days, let us translate, all of us, translate discovery into delivery. Success will be measured not just by our words, but by the actions we inspire and by the impact we create together. Let us build a future where the next generation of Africans inherit a health system that is resilient, that is self-sufficient, and second to none. Thank you very much for the opportunity.
Thank you very much, Dr. Shahabuddin. Next, it's my pleasure to introduce, on behalf of the World Health Summit, to introduce the President of the World Health Summit, which is based in Berlin, Dr. Axel Prius.
Thank you, Lukoi. I will be very brief here, but I already feel the energy stimulated by the President and all these excellencies here, but also the friends and enthusiasts for health in Africa, but even beyond Africa in this room. And the next days will be very, very relevant to pushing it to the priority level, to the level it actually deserves. And I think after these 3 days, we will see real progress. And in this context, I would like to invite President Ruto to come and speak at the World Health Summit in October in Berlin. To show the world what is happening here and what has happened here and what will happen here. Thank you very much and have good 3 days.
Thank you very much, Axel. And thank you. I think this year's World Health Summit regional meeting is absolutely important because it comes at a time when everything has changed in the health infrastructure in the world. Africa's health agenda is under an acute threat. We have had cuts from development expenditure from the partners that we have traditionally been working with. We've had climate shocks that are affecting the health agenda on the continent. We have supply chain fragility, and we have a global retreat from multilateralism, which means that African health systems face their most difficult decade since independence. This summit arrives at a moment, therefore, of acute need. The second thing that I would just point out is that Nairobi is absolutely the right place for us to have this conversation. And there are many reasons, and the President is going to tell you why, but because we are pioneers in many ways in innovating in the health space. Nairobi symbolizes Africa's ambition and institutional credibility. The UN is settled here, as the DG has just told us. And then the World Health Summit is a unique forum that brings together policy actors, political actors, but also brings together academics and researchers, and brings together people in civil society, as well as in industry and private sector. And all of them will be thinking over the next 3 days about reimagining African health systems in the context that we find ourselves in today. The output of this meeting will not be like the outputs of all other meetings that we usually have. In the past, historically, meetings about Africa and Africa's health have been about lamentations, have been about framing the problems, have been about, basically begging and saying that we have a problem and we need help, and have been about listening to people coming into Africa to tell us what our problems are and what solutions they think we need to fashion. This meeting will be different. In this meeting, we will indeed identify those problems that we have always identified, but we will also generate solutions in this meeting. But beyond generating solutions, we will make commitments about the actions that we need to take in order to solve those problems. And finally, we will develop frameworks for accountability so that next year we will come back and ask ourselves whether we did the things that we promised to do and whether we solved the problems that we promised to solve. So that will be the difference between this meeting and the previous meetings that we have held that look at African health problems in the context of global health. Ladies and gentlemen, I wish all of you a fantastic time during this meeting, and I hope that at the end of this meeting, when we issue the declaration that we shall, it will be a declaration that is binding, and it will be a declaration that has actionable points that we will all take home and implement. I thank you very much.
Thank you so much, Dr. Lukoya. Excellencies, we will now transition to our special addresses, and it is now my distinct honor to invite Ms. Brigitte Bickel, the Director General Africa from the German Ministry for Economic Cooperation and Development. Welcome, ma'am.
Good morning, Honorable President Ruto, all excellencies present, ladies and gentlemen, let me also say all protocols observed. It's a real honor to be here on behalf of the German Federal Minister for Economic Cooperation and Development, Reem Alabali Radovan, who unfortunately will only arrive tonight, but she will be here at the meeting as well to follow the discussions. Ladies and gentlemen, many of us realize the importance of health when we suddenly have a health problem. When a pregnant woman does not know whether she can get medical aid in an emergency, or when a pandemic leads to closed schools, empty markets, and families losing their income. So health, it's not just a matter of hospitals and doctors. It is the foundation for people to make their own choices in life and for social cohesion and progress in Africa, just like in Europe and everywhere in the world. And this foundation is currently under pressure. The world is changing. It was mentioned earlier. What was considered reliable for decades is turning out to be fragile now. We see cracks appearing in the international order, cracks that in some cases are already leading to its collapse. Fundamental principles like international solidarity, human rights, and bodily autonomy are being questioned. And I'm also greatly alarmed about developments such as the expansion of the so-called global gag rule. Global challenges can only be met through joint effort, with international cooperation working together. And this is especially true for health, because disease knows no borders. So it is all the more important that we here today for the World Health Summit regional meeting with a focus on Africa are meeting, and the motto couldn't be chosen better. Innovation, integration, and interdependence are exactly the elements we need in order to reimagine Africa's health systems. Europe and Africa are partners in these reform efforts. We share the goal of a global health policy that is based on human rights and scientific evidence, and on respect and true partnership. Together, we have achieved impressive progress in the past. Since the turn of the millennium, child mortality has been halved, and thanks to the work, for example, of the Global Fund, far fewer people are dying from AIDS, malaria, and tuberculosis than in the past. So these achievements, even in difficult times like the current ones, must be protected by all means. And that requires reforms of the global health architecture. It must become more effective and crisis resilient. It is up to us to move forward in this regard. I believe that 4 points are key for that. First, we need to strengthen health security worldwide. In practical terms, this means in the international community, we need to prevent future epidemics and pandemics at the earliest possible point and ensure that people and countries have quick and equitable access to medical products. This is certainly a lesson learned from the last pandemic. The African Union has set itself the goal that 60% of the pharmaceuticals needed in Africa should also be produced locally. This is an important milestone for Africa and an important contribution towards global health security if we meet this target. Germany is assisting African countries in strengthening local production capacity, for instance, with regard to adapting regulatory systems, train skilled workers, and enhancing the relevant quality infrastructure. Second point, we want to strengthen country ownership and sovereignty, and this is exactly the spirit I have heard on this panel this morning. The AU's Africa Health Strategy is very clear on this point. African countries want sovereignty over their health policy and financing. They want to have more ownership of how they design and finance their health systems. At the same time, it is clear that ODA, official development assistance, is shrinking. In the future, external support will be a smaller share in countries' health budgets. In middle-income countries, external support might even be phased out in some cases completely. So this alone is reason enough to make health a clear priority in national budgets. And having said that, even if Germany will remain a reliable partner for African countries, let me stress that point. The third point I want to mention is we need innovative financing instruments. As I said, official funding will probably shrink, at least internationally. Domestic funding will hopefully move up. But there are innovative instruments out there to also meet urgent funding needs in the health sector. Especially for heavily indebted countries, innovative financial instruments such as debt swaps can play a major role. They enable, for example, partner countries to channel funding into their health systems instead of spending it on debt service. Last year alone, Germany committed to cancel 100 million euros in partner countries' debt for debt-to-health swaps. This funding will be channeled to programs of the Global Fund over the next 3 years. Germany will continue to use debt swaps, and we would actually welcome if other countries could use such instruments where they can make a meaningful contribution towards strengthening national health policies. Fourth point, we must make our multilateral cooperation more efficient and strengthen it at the same time where we see multilateralism under threat at the moment. In the international community, we can use our funding in an even more strategic and effective way by establishing closer cooperation among global health funds and countries, and by making sure that programs are closely aligned with national priorities, and also by making sure that the mandates of the funds complement each other without duplication. A few weeks ago, in Sierra Leone, where I, together with my minister, was able to see for myself how well this can work, at a health center that provides malaria vaccines for children and simultaneously educates mothers and treats them for malaria. This was possible thanks to cooperation between Gavi and the Global Fund and, of course, the Ministry of Health of Sierra Leone. This working together, I think, is the way forward for all of us. In my view, these 4 points will be key in order to make the global health architecture more effective and crisis resilient in the future. However, that will only work if we, as policymakers, involve the private sector even more closely in the future. The present summit meeting is sending a strong message in this regard as well. Germany works with its partner countries in creating a reliable and investment-friendly environment for the private sector. In the EU Health Partnership, and I see many other EU member states and the Commission sitting here as well, we work together to strengthen Africa's health and pharma industry in a strong partnership. Together, we want to promote more investment where it can improve medical care locally and continent-wide, and where it creates decent jobs and makes Africa more independent for future crises. Ladies and gentlemen, investing in global health means investing in the lives of millions of people, and yes, also in our common security. Because strong health systems are the best joint defense against crises that go beyond borders and destabilize societies. Germany will remain a reliable partner with substantial contributions, for example, to the Global Fund and Gavi, and towards strong multilateralism and strong partnerships on an equal footing. The World Health Summit is one of the most important platforms in this joint effort. Let me close by thanking the Aga Khan University and the World Health Summit very much for hosting this regional meeting. And of course, a special thank you again to President Ruto and the Kenyan government, who is facilitating this meeting as an AU health champion and thereby lending it political weight. Let me close by also looking ahead. My minister, who is arriving tonight, will be traveling onward to the G7 meeting in Paris. And let me say that she will carry the messages coming from this meeting to the G7 discussions, which will also have a focus on health and global health security. So the messages from this meeting will be taken back to Europe and into the international discussions. Thank you very much for your attention.
Thank you very much. I now wish to invite the Regional Director for WHO Afro, Dr. Mohamed Janabi, to make his remarks.
Your Excellency, Dr. William Samoei Ruto, President of the Republic of Kenya, Cabinet Secretary, Minister of Health, Honorable Aden Duale, Dr. Suleiman Shababuddin, President and Vice Chancellor of the Aga Khan University, Professor Axel Price, President of the World Health Summit, Dr. Jen Kaseya, Director General of Africa CDC, Madam Zainab Hawa Bangura, DG of the UN offices in Nairobi, Honorable Ministers, distinguished guests, partners, colleagues, good morning. Hamjambo. Your Excellency, allow me first to congratulate you and the people of Kenya on a moment that inspired the world. Yesterday in London, Kenyan Sebastian Sawa Your Excellency, Sebastian Saya sounds like a name from Tanzania, but he made history, winning the London Marathon and becoming the first man ever to run official marathon in under 2 hours. Let me be more precise. He ran 1 hour, 59 minutes, and 30 seconds. It was more than a sporting triumph. It was a reminder of what discipline, resilience, and belief can achieve when preparation meets purpose and when the impossible becomes possible. That lesson could not be more relevant for us today. The WHO African region is honored to co-convene this first ever World Health Summit regional meeting. This is a historic moment, not simply because we gather here in Nairobi, but because the decisions we take now will determine how resilient our world will be in years ahead of us. Today, forces of disruption and transformation are converging. Too often, we are offered false choices: health or security, livelihoods or lives, solidarity or sovereignty. We reject these trade-offs because there is no prosperity without health and no security without a resilient health system. Investment in health is not a charity. It is insurance for our shared future. And that investment is not measured only in US dollars or sterling pounds, but in trust, in knowledge, in systems, in people, and in innovation. Our world is profoundly interconnected. A failure in one place can send shockwaves everywhere, and we saw it during COVID. Borders will not stop it. Distance will not delay it. The timing may differ. The intensity may vary. But in the end, we race together, and we fall together. As an African proverb reminds us, if you want to go fast, go alone. If you want to go far, go together. That wisdom speaks directly to this moment. Pandemic preparedness begins with strong primary health care. Digital innovation and artificial intelligence expand access and strengthen delivery. Climate resilience is inseparable from health security. Gender equity and youth leadership ensure progress is inclusive and lasting. Beneath everything we discussed this week lie two fundamental questions. How do we make systems work? And how do we finance them sustainably? Let me share three guiding principles for our discussions: planning, prioritization, and partnership. First, with planning. Systems do not align by accident. Funding does not appear on its own, and silos do not dismantle themselves. That is why WHO supports countries to adopt a one plan, a one budget, and one report. A single government-led, data-driven national health strategies. One financing framework, one result systems, and everyone aligned. This is how we move from fragmentation to efficiency, from duplication to impact. We cannot do everything, but some things, really, they are not optional. Primary health care must come first, our most cost-effective investment for prevention, chronic care, maternal and child health, and outbreak response. Alongside, we planned local manufacturing. A very well-planned local manufacturing, I have to understand. Pandemic preparedness and climate-resilient infrastructure. We must meet the urgent needs of today without borrowing vulnerability from tomorrow. Finally, partnership for financing, starting at home by working differently with Ministry of Finance, strengthening public finance and expanding physical space for health. Engaging the private sector through blended finance and impact investment, aligning financial returns with social value, and deepening regional and global cooperation through new platforms, financing hubs, and trade frameworks. If some old doors have been closed, we build new ones. At its heart, health is a moral responsibility to protect life and dignity, and if we act as a good steward of what we have, stand in solidarity with one another, and lead with courage, starting here in Nairobi, Africa is not waiting for permission. Africa is ready to lead, and WHO is here with you. Asanteni sana, thank you.
Thank you so much, Dr. Janabi, and thank you for reminding us that the strength of our health security lies in the resilience of our primary health care, that when we protect our community, we protect the globe. I now please welcome the Director General of the Africa CDC, Dr. Jean Kaseya, to deliver the final special address.
Your Excellency, President. Oh, there is music. You want us to enjoy some music? It's working, this remote? Okay. Okay. Excellency, I was told that we wanted to celebrate what you are doing. Your leadership is following what Nelson Mandela was doing. You know, in 2010, when we were celebrating the first World Cup in Africa, Mandela made a strong statement. And he said, our future belongs to those who believe in the beauty of their dreams. But at that time, we are not talking about sovereignty. You are one of the first head of state we have in Africa speaking about what it means, sovereignty. But we cannot talk about sovereignty if we are still losing a number of mothers and children in Africa. Since you arrived in this compound, Excellency, let me share with you, already 20 women passed on because they wanted to give birth. We have already 114 children, new babies who passed on, and more than 300 children under 5. It's too much. It's too much if we compare with other continents or countries with similar population. This is why you decided in February 2026 to appoint President Samia as champion to lead the agenda of maternal and child health. We hope to make progress on that. But to make progress, we need a bold vision, the vision that our continent deserves, and the vision that is coming from the leadership of our head of state. This is what we call the Africa Health Security and Sovereignty. This is the agenda that is driving us under the 5 pillars. And all of us today, all colleagues who came here, they were talking about some pillars of this vision. We know what we want in Africa. We are led by clear vision, and we are led by visionary leaders. One of the first leaders we are talking about is President Cyril Ramaphosa, who is our champion for PPPR, Pandemic Prevention and Response. We made progress in Africa. Look where we were in 2020, even in 2022. In 2-3 years, you can see the progress we made. In all areas, we managed to transform Africa from red to green. Yes, as Africa citizens, we are proud of that, but we are also working with all partners to make this one as a success story. What is the impact? The impact is, for the first time, we see a decrease in terms of outbreaks in Africa. We need a strong nexus, health, security, climate change, to continue to make this progress a successful and sustainable progress. We also made the progress in terms of local manufacturing. Excellency, when our leaders, they decided to again give you another art. I don't know how many art you have. I was talking with you, I think 6 or 7 at African level. But we said, can you accept to be champion for local manufacturing? You accepted. The word you gave me, it was, I don't want again to see this continent being dependent. And we are dependent because we want it. Africa is manufacturing a number of products today, from Egypt, from Kenya, from South Africa, from a number of countries, but we are not buying our own product. Who is asking us not to buy our own product? Who is asking us not to register to African Medicine Agency for the regulatory aspect? It's not Germany, it's not Europe. It's ourselves. We need to change our mindset, and we count on you, Excellency. This is why you are calling for this extraordinary summit in Nairobi to discuss the end-to-end local manufacturing. We also have to discuss the health financing issue. We have our champion President Kagame. When I was meeting President Kagame in Rwanda in October 2025, he was telling me, we need to change the paradigm. How can we accept that more than 50% of our people are paying what we call out of pocket to have access? This is not sustainable. This is not to build universal coverage. We need also to see how to reverse the trend of inefficiencies. Yes, we are doing some effort to raise more funding, but we are losing most of our funding, around 50%, due to inefficiencies. Who's telling us not to fix our system? Why are we blaming Western countries if ourselves we cannot do the job we need to do? Yes, let us talk about Kenya. I'm so proud to be today in Kenya. Yes, Kenya is moving. Kenya is making us proud. We can see under the visionary leadership of President Ruto, we have the digital health transformation agenda. I was told that it was 27 million already registered, but President, you corrected me this morning. You say already 30.6 million. Every single day, we have around 25,000 people registering. And as Minister Dwale was telling me, by the end of this year, we can achieve almost 90% of Kenyan population registered. This is what we call leadership. And I was briefing Prime Minister Abiy 3 days ago in Addis about what Kenya is doing, how we can take it forward in other African countries. President, you are making us proud with this program. When we talk about all of these pillars, we then talk about what's our vision for the reform of the global health architecture. I was saying to President Ruto this morning, he's making my life miserable because he is in all areas of our pillars. He was the first head of state talking about the reform of the global financial architecture that led for him to become the champion for the reform of AU. Colleagues, we are clear in Africa and we are led by the decisions from the AU Assembly. I'm glad to announce today, this afternoon, 25 ministers from Africa will be meeting to discuss what is the voice of Africa. And I'm glad that the Vice Prime Minister of Egypt, who flew for the first time to Sub-Saharan, and this is the magical aspect of the thing, to attend and to co-chair this meeting with Minister Pate and myself, will unify the voice of Africa that will bring to the WHO World Health Assembly, but also to the G7, because President Ruto will represent us to the G7. Excellency, when we talk about all of that, when we fix our system, then we can talk about our partners. We changed the way Africa is seeing things. When I was in the cabinet a few years ago, we were talking first about partners. Today we start talking about ourselves. What can we do to fix our system, then to go to partners? Our model is led by what my sister Sanya is doing for Gavilip. Thank you, Sanya. Because we need to see partners respecting us. Yesterday I was talking with my brother Ankar, who is the president of GATE Foundation. He said to me, our GATE is aligned now to support our sovereignty agenda. We have more than 300 partners. All of them, they will respect us when we fix our own system. When we start to be more relevant, we are delivering and we are implementing the program as we need to do. Excellency, more than 300 partners are waiting for you to give guidance, to say how things will be in the future, by starting by saying how ourselves we consider the Africa we want. Then we'll fulfill what Mandela was saying again. Mandela told us, I dream of an Africa which is in peace with itself. No one will come to create peace for us if we don't build that ourselves. Thank you so much.
Thank you, thank you. Thank you very much. And thank you to all our speakers for setting such a strong foundation for this summit. And indeed, global health security is not a luxury. It is the prerequisite for national and global stability. Excellencies, ladies and gentlemen, to deliver the official welcome address and to subsequently invite our chief guest to address us this morning, Please join me in welcoming the Cabinet Secretary for Health in Kenya, Honorable Aden Duale.
Your Excellency, a warm welcome to the World Summit Regional Meeting 2026, hosted by the Aga Khan University and convened here in Nairobi in collaboration with the Ministry of Health, Africa CDC, and the World Health Organization. In this room, Your Excellency, we have Ministers of Health and Finance from over 17 countries across Africa and the European Union. We have scientists, we have researchers, we have clinicians, innovators, civil society leaders, industry leaders, investors, diplomats, and development partners. And we are all united by a very shared commitment to health security, health system transformation, and Africa's future. They have traveled from more than 50 countries across 5 continents. Over 2,000 delegates are gathered here, and every one of them is keen to hear your vision and your address. It is befitting that this summit is opened by a leader who embodies its very theme, reimagining Africa's health system, innovation, integration, and interdependence. A leader who has made universal health coverage a national priority in our country. A leader who champions Africa pharmaceutical sovereignty. A leader who speaks of health not as a cost, but as a driver of economic transformation and continental dignity. Ladies and gentlemen, please rise as we welcome His Excellency Dr. William Samoei Ruto, President of Kenya, to deliver his inaugural keynote address and the opening address of the World Health Summit. Thank you very much.
Please, ladies and gentlemen, let's take our seats. Your Excellencies, Honorable Ministers, Ambassadors, distinguished scientists, innovators, delegates, ladies and gentlemen, good morning and welcome to Nairobi and welcome to Kenya. I welcome you all to Kenya for the World Health Summit Regional Meeting 2026, an important event that reflects a fundamental in the global recognition that Africa is no longer a passive participant in global health, but an active architect of its direction, priorities, and outcomes. That this summit is convened on the African soil for the 3rd time is an acknowledgement that the future of health policy, innovation, and delivery cannot be meaningfully advanced without Africa at the front and center of both deliberation and also execution and implementation. On behalf of the people and government of Kenya, I convey our deep appreciation to all partners and institutions whose foresight, collaboration, and commitment have made this gathering possible, and to each one of you whose presence here represents the full spectrum of leadership required to drive meaningful change in this space of health. You have already been welcomed to this compound by the Director General of UNON, and she said correctly that this is the only UN headquarters in the Global South. But let me add that it is the largest UN campus in the world. Because the government of Kenya did give 140 acres years ago to this institution, because we believed then, as we do today, that global action gets everybody to the right place, and we can find solutions, not in isolation, but we can find solutions together. we are believers, and I dare say very strong believers, in multilateralism and collective action. This summit is anchored on a clear and urgent imperative. It calls on us to reimagine Africa's health systems through innovation, integration, and interdependence. It challenges us to design practical pathways that translate into better outcomes for health in our continent. Africa today stands at a critical intersection defined by stark disparities and immense opportunity. We carry, on one hand, more than 25% of the global disease burden, yet account for less than 3% of global health expenditure on the other hand. We remain heavily dependent on external supply chains for essential commodities such as medicines and vaccines. We produce less than 2% of what we consume. At the same time, despite the dedication and resilience of our health workers, the density of our workforce remains significantly below global benchmarks. This imbalance is neither sustainable nor tenable. It calls for a decisive and deliberate shift from fragmented piecemeal interventions to a comprehensive and system-wide transformation anchored in coherent strategy, financed through both domestic and global capital, and sustained by strong governance and accountability institutions. At the same time, Africa possesses unique advantages that must be fully harnessed, including an energetic and useful population, rapidly expanding digital infrastructure, and a vibrant culture of innovation, which together position the continent as a source of scalable solutions rather than a repository of persistent challenges. Our responsibility, therefore, is not merely to recognize Africa's potential, but to fully realize it through coordinated investments, policy alignment, and institutional strengthening that can deliver impact at scale and speed. Ladies and gentlemen, in Kenya, we have sought to translate this vision into action by undertaking a comprehensive reform program that places health at the center of our national development agenda, recognizing it as a driver of productivity, equity, and long-term economic growth. To us, health is not a cost. It is an investment. We have enacted transformative legislation that establishes a durable framework for universal health coverage, ensuring that reforms are not dependent on political cycles, but are anchored in law, institutional continuity, and public accountability. Through the Social Health Authority, we have implementing a unified financing model that expands risk pooling, reduces out-of-pocket expenditure, and ensures that access to quality health care is determined by need rather than income or geography. Since its launch in October 2024, nearly 30.7 million Kenyans have registered as members of SHA. This means that the number of Kenyans with health insurance has grown nearly fourfold from 8 million just 2 years ago. In the same period, we have collected 169 billion Kenya shillings, that's about $1.3 billion, in the Primary Health Fund, the Social Health Insurance Fund, the Emergency Chronic and Critical Illness Fund, and the Public Officers Medical Scheme Fund. And we have paid out 124 billion Kenya shillings, close to $1 billion, as reimbursements to facilities for care provided. Through a strengthened primary health care system. We have expanded our community health system and deployed more than 100,000 community health promoters across the country, enabling care to reach households directly and ensuring early detection, prevention, and continuity of care, as well as effective linkages to secondary and tertiary facilities. Through sustained investment in digital health systems, we are integrating data, improving transparency, and enhancing decision-making, recognizing that effective health systems depend not only on infrastructure and personnel, but also on reliable, real-time information. Digitalization is not only enhancing efficiency in service delivery, but also promoting fiscal accountability, particularly in the context of shifting global development assistance landscape. And I know I am speaking to policymakers. I know I'm speaking to ministers from across our continent. If I were to tell you from my point of view, the three significant things that will make the difference for us in this continent. Number one is policy leadership. You need policy leadership on matters health at the highest level, because it requires making difficult decisions. And if policy leadership is not aligned, you cannot make the decisions that will create the impact that you need to deliver health, especially if you are looking at universal health, health that reaches everybody and leaves nobody behind. The number two requirement from where I sit is we need to understand that first and foremost, delivering health is our responsibility as governments and as Africans. First and foremost. Any other assistance we get is secondary. The challenge that I see is that many of the leaders in our continent believe that it is somebody else's responsibility. It should be the World Health Organization, USAID, I don't know who, and all the other friends. That is how we go wrong. Delivering health is first and foremost our responsibility. And because it is our responsibility, we have to design ways and means of raising domestic resources to fund our health delivery systems. And it is possible and it is doable. I will give you Kenya's example. A couple of years ago, we used to contribute $3 for health insurance. $3. We then moved it 5 years ago to $15. The highest being $15. Of course, we didn't raise enough resources to be able to run our health systems, and these are for salaried people and people who can afford to pay. But in the last 3 years, we changed the financing model, and we said every citizen will pay 2.75% of their income into a pool where we use to pay for our health insurance. That has changed the landscape significantly. That is why I've just told you, in the last 1 year, we have raised $1.3 billion. Domestic resources. It is 3.5 times what we were raising 3 years ago. We haven't gotten richer. Our salaries have not changed much. But we just realized that this is not a cost, this is an investment, and it is important for us to invest. The difference is like day and night today. Why am I saying this? I am saying this because I know I'm speaking to policymakers. Some decisions have to be made, and the sooner we realize that it is our responsibility to raise, especially domestic resources, to fund our health, the better for all of us. And finally, the third thing I will want to tell you as policymakers is to leverage on technology. Technology has a way of injecting magic into things. Efficiency, accountability become easy when you leverage on technology. And you will find a lot of resistance to technology and to any adjustments on funding. I will give you an example. If you read one of the headlines of one of the newspapers today in Kenya, there's a big headline saying how teachers and civil servants have rejected our health system. That headline is not coming from the civil servants, it's not coming from the teachers. It is coming from business interests, people who have been benefiting from health insurance before. We used to spend, on teachers alone, we used to spend $200 million every year. Today, we're spending $140 million. We have saved $60 million. The fellows who used to make the $60 million are the ones sponsoring the headline because they have lost business. Right? So this is the kind of resistance you go through when you make the changes that create impact. If you ask teachers today in Kenya, they were limited to 900 hospitals. Today, because we changed the system, they have access to 6,000, close to 7,000 hospitals. They no longer have restrictions on which hospital they can go to. They used to have access to only one level 6 hospital. Today, they have access to all level 6 hospitals. And as I talk here, one of the person agreeing with me is a person who runs one of the largest hospitals in Kenya, the Aga Khan Hospital is right there. And he knows what I'm talking about. But you see, it is easy to be distracted by business interests, by cartels and people who profiteer from the health space. But you see, technology has really done the magic for us. Today, we have integrated our own systems together with the hospitals, so the hospitals can follow. They have, visibility of what is going on. And we can better manage our resources. And therefore, as I talk to ministers from our continent, and I talk to you from a position of knowledge and experience, policy leadership, technology, making sure that you raise local resources to first and foremost drive your health requirements. Any other support you get is secondary. These reforms have neither been easy nor flawless, yet they represent meaningful and significant progress for our people and a clear departure from the constraints of the past. We recognize that transformation is an ongoing progress, and as we advance, we continue to refine and to strengthen both the systems and its underlying architecture, learning, adapting, and improving to ensure it delivers fully and effectively for everybody. Kenya's experience demonstrates that when political leadership gives priority to health as a fundamental pillar of development, aligns policy with financing, and centers service delivery on communities, and transformation therefore becomes both achievable and also sustainable. Distinguished delegates, the future of Africa's health systems must be shaped through collective continental action that addresses both long-standing gaps and emerging pressures, including the rise of non-communicable diseases, the growing burden of mental health conditions, and the profound impact of climate change on health outcomes. And I believe that's the essence of this meeting, to bring all of us together so that we can share our experiences, we can learn from what others are doing, and we can pick from the best and do what we must. This requires deliberate choices, including increasing domestic health financing in line with our commitments, strengthening local pharmaceutical manufacturing capacity, investing in training and retention of health professionals, and ensuring that digital innovation serves as a tool for inclusion and accountability rather than exclusion. It also requires us to institutionalize preparedness for future health emergencies by strengthening primary health care services, enhancing surveillance systems, improving regional coordination, and supporting continental institutions capable of responding effectively and rapidly to emerging public health threats. In addition, Africa must position itself at the forefront of biotechnology and advanced research by investing in genomics, vaccine development, and local manufacturing ecosystems, thereby transitioning from a consumer of innovation to a producer of globally relevant solutions. And it matters when policymakers make those choices. I will give you an example of Kenya. We have almost 40 manufacturers of health commodities in Kenya. Some of them, like one company called Revital, export to the US, they export to India, they work with the World Health Organizations and many of global health companies that require commodities. But you will be surprised that the policy arrangements in Kenya did not recognize some of these manufacturers and actually excluded them from us buying commodities from them. And then you ask yourself, I mean, you are producing a commodity that is being imported globally, and you cannot buy it in Kenya. Why? Because, you know, I don't want to say. So policy makers must think through and support locally manufactured commodities as a way of building our capacity to be able to produce. And talking about Revital. Revital is a Kenyan company owned by Kenyans, you know. So when you ask the people at the Ministry of Health, why are we not buying from these people? There is a lot of English and words, and there is no substance, you know. So you as policymakers must have a keen eye on what is going on so that you make the right decisions. To our global partners, I wish to emphasize that Africa seeks partnerships grounded in mutual benefit, aligned with national priorities, and focused on long-term investment rather than short-term assistance. A healthy Africa is indispensable to global stability, economic growth, and shared prosperity. The question before the international community is therefore not whether to invest in Africa, but how to do so in a manner that is strategic, sustainable, and transformative. Ladies and gentlemen, again, let me welcome all of you to Nairobi. Enjoy your stay in this city. There is a national park around the corner. From your hotel, maybe it is anywhere between 10 and 15, maybe 20 kilometers, maybe 20 minutes from your hotel. And the national park is, we have wild animals there. They are not in the zoo. And occasionally, because we've tried to fence, but occasionally you will find they stray from the fence. You may find a lion somewhere if you do a morning jog. Please be careful. They are wild animals. And while here, enjoy the hospitality of the people of Kenya. We are carnivores. We eat a lot of meat. So you will find something called nyama choma. It is very well done roasted meat. Please enjoy yourselves and stay longer beyond this conference. And if for any reason you feel at home, which you will, it is because this is the origin of humanity. Everybody here has come back home. So enjoy. It is now my honor and privilege to declare the World Health Summit Regional Meeting 2026 open. Thank you very much.
Another round of applause for His Excellency and all the speakers. With your permission, Your Excellency, allow me to just give the exit protocols. We've come to the end of this session, and I'll give the exit protocols without using a lot of English. And we shall have a photo session by the stairs, and this photo session is for cabinet secretaries, ministers and principal secretaries present, together with our NEPAD lead. So at this point, I request that we be upstanding as we allow His Excellency to exit first, followed by the cabinet secretaries, ministers and principal secretaries as we proceed to do our photo session by the stairs. We'll have Kayamba Africa give us some music as we allow His Excellency the President to exit. Thank you, and do have a wonderful day.
Sore mwana wa masore. muledi wa masore, sore muledi wa masore, sore mwana wa masore, sore mwana wa masore, sore muledi wa masore, sore